Welcome, and thank you for joining us for today's Bridge Lunch Break event, all about the Flint water crisis 10 years later. My name is Jackie Garrett, Fund Development Associate at Bridge Michigan, your source for nonprofit, nonpartisan news in Michigan. In this hour, we'll discuss the far-reaching impact of the Flint water crisis on the city's children and families. Today, our special guest panelists will include Dr. Hernan Gomez, pediatric physician at Hurley Medical Center, Pamela Pugh, president of the Michigan Board of Education, and Ashley Strozier, a Flint parent. Bridge Enterprise reporter Ron French will moderate this discussion. Our conversation will begin in just a moment, and Ron will lead the discussion with Dr. Gomez, Pamela, and Ashley for about 30 to 40 minutes, and then we'll turn to your questions. Please type any questions you have for our panelists into the chat window at any time. If you're not a panelist, please remain muted throughout today's discussion. We are recording today's conversation that will be posted to Bridge Michigan this week. You can subscribe to our newsletters by visiting www.bridgemi.com and click subscribe. Events like this one are made possible by the support of Bridge members. If you'd like to join this membership community, we will drop a link to do so in the chat. And another reminder, please stay muted throughout today's conversation. I will now hand it over to Ron to get us started.
Thank you very much. Here I am. Okay. Thank you very much, everybody. And thank you all for being here. And thank you to our panelists. I'm just thrilled that we have such three great people who can talk on this topic, who all had different, but in some ways parallel experiences with the crisis at the time. For people who aren't from Flint, okay. Sometimes I think that the water crisis was like a I don't know, like an asteroid crossing the sky. It was like, oh my God, there it is. Oh, this is such a big thing that we're all noticing. And then, oh, now everything must be back to normal. Okay, right? Because we're not talking about it every day like we were a decade ago. And for the people in Flint, I know this is something that is still front of mind. Let's just dive right in and chat about this. Dr. Pugh, if I could start with you. For people maybe outside of Flint, this seems like something that's in the past. Okay. But from your viewpoint as a community and education leader, is the Flint water crisis over?
Well, I serve as president of the State Board of Education, and I should also note that I also served as the chief public health advisor for the city of Flint. At the height of the water crisis, I was brought in response to the water crisis. And so that is where I speak from. And there's a parent and a professional who's also here that will give their own perspective. But as I traveled through Flint, was in Flint just a day ago, definitely spent a lot of time in Flint. And so my data comes from the people. And what the people will say is that no, the Flint water crisis is not over. And it is not over because the pipes have not been replaced. There have been other communities that have sped past Flint in replacing pipes. There are fixtures in the homes that were damaged, infrastructure within the home that was damaged that has not been repaired. The city of Flint still suffers from high water costs. There have been no criminal charges yet that have ended in someone having culpability for the poisoning and the deaths that occurred in Flint. And the settlement dollars have not come through yet. And so as a person who has studied environmental justice most of my adult career and public health, I've traveled to places like Dixon, Tennessee, where we were coining Dixon, Tennessee, a community that drank water laced with a carcinogen as the poster child, and then being here in the city of Flint. When I study environmental justice, I look at the health effects, but I look at the injustices that we look at, procedural injustice. Flint was not included nor heard for 18 months in the switch to the deadly water switch. When we look at corrective justice, I just talked about the fact that there has been no one held culpable for what has occurred. When we look at social injustice, we can talk about the fact of what led to the devaluing of lives that led to the Flint water crisis, as well as how we're still not seeing resolve. And being a social injustice. I could go on and on, but looking at the people of Flint, we have learned a lot about environmental injustice. We've learned a lot about infrastructure and the needs across this country, across the world. There have been people who have benefited from the demise of Flint, but Flint has not been made whole yet. And we can talk more about the children. Yes, these children are resilient. Yes, we can have high expectations from the children, but that does not mean that an injustice was not done unto the children and the people of Flint. So Flint is not made whole. The water crisis is not over.
Wow, that's a good introduction. Thank you so much. Ashley, you were a young mother a decade ago. And if you could, just for this question, just talk from a historical perspective. What was it like? What was it like for you and your family? What were you noticing about the water? What were you noticing with your children? What were the fears for you and I'm sure the other moms in the area that you talked to at the time?
I would say that my experience was very unique. At the time of the switch, my two children at the time were, my daughter had just turned 2. My son was about 4.5 because he turned 5 in November. So I had two children under the age of 5. And at the time of the switch, there was a lack of information, wasn't sure what was going on. So I was just doing what I thought I was, what I thought to be best, making sure my children were fed, clean, they were in Head Start, and I just proceeded being the good parent that I thought I was being. Um, what really was a noticeable change, I noticed with my son first. Pretty healthy kid, never had any issues, but then all of a sudden he was diagnosed with asthma. So dealing with that, my daughter turned 2 on May 16th. By May 30th, my child was in the hospital at Hurley Hospital having major surgery. She had a huge chunk, somewhere around 89, 91% of her right lung removed, because I truly believe that she was the earliest case of Legionnaire's disease amongst pediatric patients. Because we didn't know that verbiage at the time. It was documented as a very severe case of pneumonia. But my new 2-year-old spent 28 days at Hurley Hospital, and it was a scary experience. They did not know she was going to successfully come out of that surgery. Didn't know what life was going to be like for her afterwards. And she spent so much time in the hospital, she had to learn how to walk all over again. She actually said her first real set of words in the hospital. So life changed for our family while she was in that hospital for 28 days. And then when we got her home, it was readjusting to what is going to be best for both of these young children at the time. I remember upon being discharged, and they were going through things that we needed to look after and steps we needed to take once we got home. And the one thing I will never forget, one of the nurses said, "I hope you don't plan on drinking the water." And I was
Mm.
like, "Well, what do you mean? We have a filter." And she said, "No, after everything that child has been through, she needs to be on bottled water. Don't even trust the filter." And she said that from a place of caring, because she saw the progress my child made in the hospital. And I respected that, because you cared for my child for several days, for several weeks. And I would think anybody in the health profession, if you see a patient making this much progress, you don't want them to have to return back to the hospital because their health took a decline. So I took the words that she said to heart, but she also said, not just for Clarissa, but for you, your son, make sure you are drinking bottled water, because we don't know the effects that this is going to have on you all later on down the line. And
Yeah.
so since then, we were using bottled water, but it was like, okay, do I really need it? I was a single mom. Do I really have the extra funds to buy 4 or 5 cases of water? Because we were using the bottled water to cook with, to wash produce with, to brush our teeth with. And that was not an account that I predicted for it in my little budget, being a single mom. And so it became a necessity. And then that's when I remember starting to go to the different spots along the city to get donations of water. I would load up my vehicle. If they were giving some out at my church, because I grew up at First Trinity, I would say, hey, Grandpa, will you grab me some water? So that's when it became, let me build a stockpile of bottled water. But at the time, I was also working at Flint schools. And so I'm working with students and families. And I know the provisions I'm making for myself, but let me make sure I share this information with those in my community. So being a trusted person in the community, if I tell a family, hey, we got bottled water donations coming on this day, make sure you get here to get it, that became a resource. And that's when my work in philanthropy began, because it became bigger than just taking care of my children. It's taking care of anybody that is within my reach. So that's the effect that the water crisis had on me. That's why to this day, I'm sitting on, I think, 3 different boards. I'm working with the Flint Registry Advisory Council. I sit as the board chair for the GISD Policy Council for Head Start and Early Head Start. And then I'm also very engaged with Young, Gifted, and Green, which is a nonprofit environmental justice organization, but I sit on their board of directors because all of these organizations that I spend time working with, those are the forgotten populations. And we have to make sure the information is getting out to those that need it the most.
Thank you so much, Ashley. Wow, what an experience. Um, Dr. Gomez, I know at the time, and also still today, as being a pediatric emergency room physician at Hurley there in Flint, and also a certified toxicologist. What were you, and we'll get into some of your studies later, but what were you seeing? Was it at the time, were you seeing any difference in who was coming into the emergency room, or maybe you weren't, maybe you didn't? And what were their increased fears at the time? What were people seeing?
Oh, sure. First of all, I just kind of want to say that I really feel honored to be here with folks like Dr. Pugh here. I think that what she says is fantastic. And listening to our mother here with her children and her experiences that she's had is truly moving. And certainly we've admitted many children through the emergency department to the pediatric ICU. I would presume that given that significant pulmonary lung disease that your child had, must have spent quite some time in the pediatric ICU at Hurley Hospital. And I'm glad that ultimately the outcome was good, but it sounds like you've been through quite a bit. I've been at Hurley Hospital since 1996. I've been there for, it's hard to believe because time flies, but it's been nearly 30 years now, at least it will be in a couple of years. I trained in medical toxicology at the Rocky Mountain Poison Center in Denver, Colorado. I trained in pediatrics actually at a small town around the size of Flint called Waterbury, Connecticut, which is a Rust Belt city, where interestingly enough, many of my early memories as a physician in training for pediatrics was treating lead toxicity. Numbers were very different back in those days. We're talking I'm dating myself a bit, 1984, 85, 86, where the CDC level, the reference range was 25. And very clear memories of speaking to parents and reassuring them that, your child's level is only 20 over here. So congratulations, it's only 20. And of course, we now know, the even levels of 20 and so forth can, over the long term, affect the child's health, significantly. So in the emergency department, besides the typical emergencies that, we might think of, gunshot wounds, drownings, and horrible things, I would say the majority of children we see are actually just run-of-the-mill. My pediatrician told me to come to the ER because they close in 1 hour. So we'll see children with cough, runny nose, just concerns that might go to the regular pediatrician. And so these were, in addition to that, we communicate quite a bit by phone with all pediatricians in the community. The concerns of, I would say the main thing that we saw during the water switch, there was the initial part where, most myself and the physician in the ER would simply read the headlines, that there are concern of citizens of Flint from the color and smell and appearance of the water. That occurred fairly soon after the water switch. Within, and maybe our young mother can explain to how quickly it occurred, but my understanding is within a couple of weeks. I mean, very rapidly. Due to famously the lack of putting in anti-corrosives into the water supply and therefore leaching of lead water lines. And so most of us in the ER and observation were that, okay, this is more of a local problem of color and odor. Go back 18 months later, and famously, Mark Edwards tested the water and found increased lead levels. And so when that occurred a bit later on, yes, we did see parents that justifiably did have concerns. I mean, of what the increased level of lead in the water might mean for their child, but also concerns that perhaps this may be a contributing factor to why their child is in the emergency department. I mean, for example, the child may have a new rash, the child may have new weakness, new malaise, any variety of issues. And the question and concern would be, could it be from the water and from the lead? So no doubt that had occurred.
Okay. Dr. Pugh, you've been very, a big leader in this for the past 10 years, and I just want to know, looking back over that time, how would you characterize the success or failure of the response to the crisis, both to decrease the danger and also to educate the families who live in Flint about how best to handle this situation? Oh, you're on mute, Pam.
The rolling of the eyes was, where do I start?
I bet.
I was in Flint, and I get the year stuff, but I was in Flint with the late superintendent Brian Whiston. It was one of his first stops. We were going to Flint, Michigan, to introduce him to the community. I think it was October 2015. You all will be able to correct me soon. And I was there the second day that the water fountains had been unplugged and from the school at the schools, because they had just found the high levels of water. And so was there on as the Board of Education member. I went to Kettering University, where the Department of Health and Human Service, or maybe it was EGLE at the time, Department of Environmental Quality, was finally apologizing to Dr. Monahan Atisha for calling her research irresponsible. And so I was there when that happened, and she and I began to talk. And from that time on, I was on the ground for about a year, volunteering with Francis Gilchrist with the NAACP, with Dr. Monahan Atisha, with Mayor Karen Williams Weaver. And that was before I started as the Chief Public Health Advisor. What I will say from the time that I was there volunteering to now is, I would say we failed the people of Flint. And the bad part of that is, us failing means that this can happen in any other community. And the people who caused this failure, who, quite frankly, it turned into more of a PR campaign from my vantage point and what I was seeing. One of the injustices that I didn't talk about was distributive injustice. And when we talk about distributive injustice and environmental justice and categorizing the injustices, we're talking about the fact that the distribution of goods, the distribution of how our government protects its people, did not go to the people of Flint. And we can say that because it was a Black and brown community. We can say that it was because of a low income community, and I will stand on that. And there has been a report from Michigan Department of Civil Rights that backs that up. So it was a failure. And as we talk about injustices in Flint, again, seeing the failure there, we will see it in other places in this country if we don't handle it the right way. And I could give examples. I was at a table where I was asked to leave as the representative of the city of Flint and the public health representative was asked to leave a meeting because they were going to be discussing the people of Flint and some of the outcome of the research. I was asked to leave. That became a big issue when the state asked me to leave. And the meeting had to end abruptly because I was there sitting in the room when the discussion was that we were going to remove bottled water from the schools. Because if we remove the bottled water from the schools, then it will make more sense to the people of Flint when we remove the bottled water from the general public. I've seen research study after research study come to debunk what anyone, definitely the people of Flint who have become the experts here, anyone with common sense and research that has proven that there have been the adverse health effects. We've seen data and other research study that has been done to spin it and make it look as if the people of Flint still don't know what they're talking about, as they did when they saw the water being brown, the skin rashes, and the water smelling and causing sickness and then death. So I would say failure.
Okay.
And let me
I think
say,
so.
we've come a long way.
Yeah, yeah.
There has been pipes replaced. There has been tons of research that has been done. It has benefited, again, this country and families and children across the world. But the hesitancy, as well as the intentional hesitancy and more so making it a PR campaign than actually addressing the issues of the people, I would still call it a failure.
Thank you. Ashley, a question I had for you, which really could have gone to anyone, but is just, you live there. I'm sure you talk to people who don't live in Flint, or you read things about Flint. What do you think the misconceptions are out there about Flint children and the crisis?
I think one of the first misconceptions is that parents or Flint parents, that we just allowed this to happen
Mm.
and we had no control over this. Whether you were a very active parent, a parent working 3, 4, 5 different jobs just to provide for your household, this affected everyone. It didn't matter what classification you fell in, what income bracket you fell in. This touched every household that had children. So to assume that we as a group of Flint parents just allowed this to happen, we didn't do anything to prevent it, that is very far from the truth. Another misconception would be that our Flint children are going to struggle for the rest of their lives with this. But the water crisis has put a different fire under this generation of children, because the water crisis breeded a generation of little tiny advocates. And you look at where these children were at in 2014 and where they are at now, they are policy changers, they are movers, they are shakers, they are walking across graduation stages with their bachelors, with their masters, with their doctorates. I mean, these children have overcome a lot of things. Now, yes, you have a nice chunk of families that have had some struggles. And thankfully, there were a lot of resources poured into the community, and some families were able to take advantage of it because, again, it's the lack of information. There may have been ABC resource available over here for children or families affected by the water crisis, and maybe only 25% of the population knew that this resource existed. So over time, we've learned as a community to go and get the information for ourselves. We've learned to lean on those trusted organizations that were there before the water crisis, that were heavy in the water crisis and did not leave after the hype was gone. Those are the organizations that we believe in and we look to be supportive to our families. They're just, I'm not a fan of the word of resilience. because sometimes resilience is in alignment with you had no choice but to. No, as a community, we could have just said, whatever, we'll just deal with it. And that's not what we did. We chose to fight back. We chose to ask questions. And it forced a lot of people to be uncomfortable because now, as a community, we're not trusting anything. We're not listening to just the information that you're giving us. We're doing our own research because at this point, I'm doing everything I can to protect those in my household. But then when I found out, or when I find out resourceful information or facts that can actually help someone, I make sure to share it. So the water crisis, as awful as it is, because it still exists, the crisis is not over. So as awful as it is, it forced us to come together as a community to protect ourselves. So
Yeah, I
yeah.
think something you mentioned there, actually, it did spark a lot of people, I think, maybe to become community leaders who maybe would not have thought about that until then. Okay, and so congratulations to you for stepping up like you have. When you talk about how children can succeed, and we should always put that in forefront. Dr. Gomez, your work had, and you may have a different viewpoint from some of the other panelists here, but you had done some work that does suggest that children can succeed, and we shouldn't view it as something that they permanently have some challenges.
Well, first of all, I'd like to say that I agree with our young mother that perhaps the word resilient is one of those words that's been overused.
Yeah.
The word resilience, I hate that word, to be perfectly honest with you. So my main concern is, and I think our young mother, touched on that simply, is that the problem with, I'll kind of get to the heart of, cognitive issues, learning issues with lead is these things, the true central nervous system affected lead is not really reversible. And my main issue is that I didn't want children in the community to believe they had irreversible brain damage. I thought that was unfair. I thought that was the wrong message. And the reason for that simply is, kind of going back to, sorry, I'm an old guy, back to days of Waterbury, and kind of, a Rust Belt community where we're dealing with, back in those days, not just Waterbury, but really the whole country. Those were the days of, leaded gasoline and so forth and so on. And because of work done by nationally in the CDC, also in the state of Michigan Department of Community Health, levels of lead in children have really dropped unbelievably significantly. And such that the numbers that I dealt with in training as a pediatrician, and even when I first came in Flint in 1996, levels in children were far higher than the levels recorded during the Flint Water Crisis. And the main issue is this: we all know, and we've heard over and over again in the news, that there is no safe level of lead and so forth. What lead does have, and I think it's important for all those who care about Flint children to understand, is that lead still acts like any other toxin, in the sense that the higher the lead level, the more toxic that element is. The higher it is, the more toxic. The lower it is, less toxic it is. Flint had much higher lead, bar none, had much higher levels in the 1990s when I first came here. During the Flint Water Crisis, lead levels increased to about, frankly, the average of Michigan, and decreased. The levels in Detroit are about twice that right now of Flint, even currently. All I mean with that message is is that it's just important for teachers and students and children to realize that it's not an irreversible system. If they're having effects from it, it can be overcome. This is not a permanent damaged issue. Many other issues, I realize that there have been levels of some educational needs that have increased during this time, but perhaps we need to look for other reasons. So that's the main message I have.
Yeah, Doctor, if I'm understanding you correctly, if I
Yeah.
can follow up with you there, is that what you're saying is you're not questioning that the water crisis writ large has had an impact.
I'm not questioning that it's been a horrific impact. Let's be very clear.
Yeah.
What I simply want to caution, for parents and students to think that they're a lost cause, because that would be horrible. I think that's an unfair message. They're not a lost cause. if there's a negative impact in school, it can be overcome, and I think it should be viewed as such.
Thank you. And Dr. Pugh, this is right up I'm giving you a softball right across the middle of the plate for you here because of all your background in education and your position now. You know, on average, Flint children are struggling academically, and a sense of crisis. And what are you seeing that is going on in the schools that maybe give you hope? And how is this being addressed in the schools?
Yeah, and let me be clear. My undergrad is chemical engineering. My master's of science and doctorate from University of Michigan, I have to put that out there, is public health. And most of my work has been in childhood lead poisoning. Yeah, so what we've been asking for the city of Flint are um things that we've been asking for our communities for a long time. Mental health supports, additional social emotional supports, that we have good student teacher ratios, that we don't have the most out of bounds counselor to student ratios in the country, that we address that we put school nurses in schools. And it's unfortunate that it took this crisis for that to happen in Flint. We've long been asking for us to not just address lead in paint, but also lead in other exposures like water. So these are things that those of us in the public health space that also recognize that you can't decouple academic outcomes from environmental exposures, that we've been asking for a very long time. And it's unfortunate that it has taken this crisis to do that. And when I talk about the research and my co-panelist research that he's done, absolutely, we know that what we're doing here are preventative measures, and we need those measures to help parents like our parents here to make sure that we put our children as urgently as possible on the best trajectory moving forward. And we have to look at, in the past, we looked at chronic lead exposures. Lead in drinking water was an acute exposure. So it kind of like skewed or we had to think of it a little bit differently. And so we do have to monitor. We need to make sure that we have the means to be able to monitor children from here on out. Some of the work that Ms. Strozier is doing and Dr. Mona Hanna-Attisha is doing. So we're also happy to see that. We cannot deny the fact that Flint community schools still have a very high proportion of children with special needs. And we need to make sure that we are adequately funding tools and mechanisms to address those needs here in Flint as well as elsewhere. And when I talk about the fact that just because children are resilient does not mean the water crisis happened. We have a lot of people who want to say that children in Flint are resilient, they'll just bounce back. And so I do agree with my co-panelists, and that is the reason why I say that just because they're resilient and we put that label on them doesn't mean that the Flint water crisis didn't happen, just because we know that we can put these prevention mechanisms in place. We know we have to keep our foot to the pedal to the metal, and making sure that we don't use any of the research or any of the talking points to allow those resources to be moved away from the people of Flint, our children in Flint.
Yeah, and speaking of pedal to the metal, actually, that's sort of a phrase I would think of when I think of you, with how you've worked with your kids. Tell us, how are your kids doing? And is there a lesson there that you would suggest that maybe could be learned?
My children are doing very well. Clarence is a 14-year-old eighth grader. You let him tell it in about 10 days, he'll be officially a ninth grader. Actually just went to his last middle school band concert last night. My daughter Clarissa spent this school year being a cheerleader for both football and basketball season. And that's a really big deal for her because she was able to be comfortable while being physically active. And I was right there on the sidelines, just ready to cheer her on, but just still being a watchful parent from the stands. But
You
both of
sound like you got great kids.
they are truly amazing. They really are, and they make me proud every day. I just they blow me away, and I'm happy that they're mine, and I'll gladly share them with the world because I know that they're here to make a difference. But um being their mom has taught me a lot, especially through the water crisis. But I don't think I have any secrets or any secrets of the trades. I just think it's important for parents to know that they know their children best. Um, Speaking to Dr. Gomez, and I was one of those parents that came to the ER. I think Clarissa had maybe 2 or 3 ER visits before she finally got admitted. And I don't remember which doctor it was, but it was the level of attentiveness that Hurley gave her. And someone came into the room and said, you know what? She's been here the last 2 nights. We need to do an x-ray on her. And it's that type of good care that our community continues to thrive off of, because how many children would have been sick worse than what she was had we not had that care right down the street around the corner. So I'm always grateful for the care that my daughter got at Hurley. I'm always thankful for the times it was 2, 3 o'clock in the morning and Clarence's asthma was flared up. And I knew nothing about asthma, but I took him to Hurley and they got him back well enough where he could go home and sleep comfortably at night. So it's those good foundations of support that I'm thankful for 10 years later, and my children are thriving. But it's just very important for parents to know, your child best, what's normal, what's not right, and don't let anyone try to tell you differently. If it doesn't fit right, don't let it go. You need to continue to fight for what you know is right when it comes to your children, when it comes to your health, when it comes to things going around your home. Um, just continue to keep pushing and keep talking, keep getting louder until someone listens. Because if you're quiet, it could be the suffering to someone else that could have been prevented. So
Be an advocate. I love that. Yeah. I wanted to, I just thought of a sort of a question for all of you, if you don't mind. And and then we'll take some questions from our listeners here today. Let me start with Dr. Gomez. And the question is, what's the takeaway here? What are the lessons that the state should take away from the water crisis and how we responded to it? Any thoughts, Dr. Gomez?
Well, gosh, I would say honestly, what happened to Flint, I view as neglecting the basics. The act of not putting in a phosphate-based anti-corrosive, it was a once-a-month additive to be put in, which, by the way, costs around $100 a month, I believe. I believe that's what $100 a month, and they neglected to put that in. And for this reason, famously, have pipes in, particularly in the older homes, with mineral buildup in the pipes, and because of the corrosion, got dislodged and reddish, smelly stuff, and of course, lead, increased concentrations of lead, breaking the lead and copper rule, or higher than 19 parts per billion, as allowed lead or copper rule. So I view that one of the lessons is don't ignore the basics. It was a very basic engineering oversight that created this whole mess. So pay attention to basics, I think, is a very important, at least one. Believe me, there are many, but I would say one very important message here.
Thank you. Ashley, any thoughts on that?
I agree with Dr. Gomez. Don't ignore it if it doesn't fit right. If it doesn't look right, it smells funny. Thankfully, my household, we didn't have any discolored water, but we also learned through all the research through all the years, your water did not have to be discolored in order for it to be harmful to your body. So, it taught us the importance of checking our water, testing your water on a regular. I know my husband had tested our water because since since my husband and I got married in 2017, we had a daughter in 2019 and then a premature baby in 2021. So still, it's still a thing in not wanting to expose these young babies to the possibility of having leaded water. So we're still testing our water just to make sure. It's just better to err on the side of caution. So my advice to Flint, if it's been a minute, if it's been more than 6 months since you've tested your water, please get in contact with your local council person and ask them for a water testing test or water testing kit, because you still need to test.
That's great. Dr. Pugh, I purposely left you to last because I knew you'd have a bunch of really great lessons for us. Go ahead.
Are you saying I talk a lot, Ron?
No, that's not what I mean at all.
So, I all of these, what Ms. Strozier has said, what Dr. Gomez has mentioned, and I really want to think about the corrosion of the pipes, definitely was a big piece of this. I won't even say it was the start. It was a big piece. But we know that we cannot continue to divest in our communities. We cannot devalue the lives of the people in our community. We live in a country where we expect our government to stand up for people regardless of who they know, regardless of what their income is, regardless of what their race or ethnicity is. Our government has to protect all of its people equally. I will say that the corrosion to the pipes was huge. And as said, at a price that does not match what the cost is to repair what was done in one of the most invaluable, or one repair that we won't be able to do, or let me say we have a long ways, is the erosion of trust of our government. And what I will add to that is that when we look at communities like Flint, this environmental injustice that was done, we look at the cumulative impacts, that disinvestment in a community that was poisoned, communities that infrastructure was corroded, a community where the trust in government was eroded. We also look at the stress that was caused by all of that. And stress in and of itself is suppresses the immune system. And the stress that continues in this community adds to the health outcomes. We looked at lead levels. We talked about birth outcomes. We've talked about educational outcomes. And so we will have to monitor our community of Flint for a long time. Great expectations. I'll put that on repeat. And we will fight for resources and preventative measures to be in place. And Flint deserves that attention.
Thank you so much. I want to take a few minutes to.
Yeah, I just want to say I agree
yeah,
100% with her issue about the stress is a huge issue. And I honestly, I think that is as important as any other issue, including lead levels, has been just that stress as a whole on the community and on our children. So I agree.
And if I could just add one thing.
Yeah.
That the CDC in their emergency preparedness talks about how man-made crisis adds to stress factors. And so this was a man-made crisis that adds to the stress that then adds to the health burden.
And then even when you speak about the health burden, I know majority of this conversation is talking about how children were affected, but you got to think about the adults that were taking care of the children. And then also, unfortunate, the data that showed all of the unborn babies and how their pregnant moms were affected, how babies were affected, the infant mortality rate went up. I mean, there were a lot of things that happened as a reaction or a reflex to the water crisis. And the data is still growing because we are still learning, and it's an unfortunate learning curve.
Yeah. well, we could talk for hours on this. I want to get in a few questions from our listeners here. One of the questions had to do, and this may be to you, Dr. Pugh, or if either or other panelists have some knowledge of this, please chime in. But we had a question about the status of early childhood education in Flint. Whether there has been an increase in access to high quality early childhood education. Are you familiar with the answer to that, Dr. Pugh?
What I will say is that the state as a whole, but definitely in Flint, we have definitely focused in on and in a bipartisan way on early childhood. Again, unfortunately, these are things that we knew for a long time, but definitely that the Flint water crisis has helped to benefit the state as a whole. Developmental screenings, access to early childhood are definitely far better than what they were when we first started. But again, we were so far. We knew that we needed to do more, and that this is a critical stage of a child's life.
And then also as the sitting chairwoman for the Parent Policy Council for the ISD, which oversees Head Start and Early Head Start, I can actively say that the door is open for those that are willing to go through the process. We have a waiting list for both Head Start and Early Head Start, but we also have other great programs where if they're not able to get into the classroom right now, we have at-home options. So if a parent wishes to have for their 0 to 5 child to be educated, to get that extra good foundation level of educational opportunity and exposure, it's certainly there. They just need to call 810-591-KIDS and the process can start immediately. So if you are someone that's watching, that's tuning in, if you know of a family that has 0 to 5, please make sure they reach out. The resource is definitely there. And I'm not just sharing that because I sit on the board. I don't participate in boards that I don't support or I don't see the work being done. My children went through Head Start. They went through Early Head Start. Briella, who is my 25 weeker, she went through, what is the name of the program that's at home? Not Project Skip, but there was an at-home based program where her teacher came to the house once or twice a week. And when she saw that my child needed an additional service, that referral that her at-home teacher put in got her inside of a classroom. And it was a beautiful thing because not only did they take Briella, they believe in the whole child approach. So Briella and Michaela got into Head Start. So opportunity is there if families would like that exposure to early childhood education. They just need to call 810-591-KIDS. And if you're not able to get through, call me, flag me down. I will help you through the process.
That's great, actually. If you're able to, if you have access to it, if you could put that phone number in the chat, that would be great. And we had one question about how do we know what the pipes are like in other communities? Well, we do have some lead exposure rates by community. If Amber or Jackie might be able to put that in the chat also, we had a story, we had a link to a story that you can look up your own, I think it's zip code or community that you can look up and get an example of what it's like today. One question we had, which is a very positive note, saying I'd like to volunteer. I have a master's of social work. What are the opportunities in Flint? Where are the needs? Do any of our panelists have any suggestions for this lovely person?
Well, you can certainly come and volunteer at Communities First Inc. Communities First Inc. is where I serve as the Family Mobility Coordinator. And Communities First is a beautiful organization where our mission is to build healthy, vibrant communities through economic development, affordable housing, innovative programming. And we are getting ready to kick off a lot of summer activities. Just putting it out there at our Community Enrichment Center located off of Hamilton Street. We're getting ready to launch an adult learning center. So if you would like to be a volunteer volunteer tutor. Sounds like you love education. I think you would make a great tutor. You can certainly volunteer in that aspect. We're getting ready to kick off Movies Under the Stars, which is a free movie family experience that we offer to communities of Flint, Saginaw, and Detroit. So there's opportunities to volunteer there, but there's also a huge community database that I would love to get you connected to. So what I'll do, I'll put my contact information in the chat section so that we can connect, because if you want to volunteer, I know many of places that would love to have you there.
That. You're a walking billboard for all these programs. I love it, actually. We have a question. I'm gonna adjust it a little bit. There was a question about what are the most urgent needs in Flint schools. I'd like to broaden that so that anyone can answer. What's your thought? All of you either live or work in Flint. What are the, because there has been some funds come into Flint to help over the past decade, but what today are the most urgent needs that if the state were trying to be involved, or volunteers, or foundations, what are the most urgent needs today? And I'll open it up to anyone who wants to answer that.
I think, just speaking as a parent, the most urgent need is for the school districts to have supportive staff. I mean, we all know that there are vacancies in these teaching positions, in these supportive services positions. And I truly believe that the reason that you see an increase in families requesting learning support services is because we've learned over the years that just because your child may classify as special needs, that doesn't mean that your child has this severe handicap or they're struggling with learning. It means that there is some type of supportive services that is out there that your child qualifies for so that they can be more successful. And that could be something as simple as speech therapy, whatever other type of therapy that your child may qualify for. And I think due to the water crisis, and now you have this group of parents that want to ask more questions, looking for more answers. If an example given, if I know that my child struggles with saying the letters W and S, I fill out the paperwork, I request the services. Now my child has an IEP so that they can receive these pull-out services. But if the district is struggling to bring in that specialist that can help that child be successful, then that's why we have this large number of students that are now looking to get learning support services, and their services may not be met, or they're met at a minimum because maybe the district may only have 1 or 2 people that qualify to give that additional support. And as a parent, I want my child to get the service that they need. But if the person is not there and they're not able to hire the person that's best for that position, then that's the issue. So we need more qualified individuals to fill these vacancies so that the districts can do what they're trying to do. I don't think it's fair to hold them accountable if they have this vacancy. We see the advertisements. We see that they're doing job fairs. I think Flint Schools had a job fair the other day. The ISD had a job fair the other day. But where are the qualified applicants? What are we doing to keep individuals that want to live, work, and grow their own families in Flint and Genesee County? So it's a double-ended sword. The districts have vacancies. The parents want their child to have their IEPs fulfilled, but where are the people? Where are the students? So it's like now they're trying to capture them when they're leaving or walking across the graduation stage. Hey, come work with us. We have to be competitive so that these college graduates aren't going to other states to get these jobs. We want them to keep them here, but we have to do a better job of making them and wanting them to stay here.
I think such a wonderful thing you did for your children, for advocating for IEP and so forth. I will share that one of my children was a special needs child, and we had to go through the whole issue of getting IEP for him. And also there's all kinds of things to navigate, all kinds of social issues within school, interacting with teachers, so forth and so on. One thing I want to emphasize is that there used to kind of be a stigma with IEP, and all parents really need to drop that. If your child qualifies for IEP, get it. Besides all the various services that our young mother described, in addition to that, there's even increased time for test taking and so forth. I will say this, and I'm looking over here, Amber put a little mess on less negative stigma about special services. I have a cousin who's a school teacher out of the New York system who's telling me that upper middle class, very competitive families in New York are taking IEP for their kids who are not, by the way, special needs. So they can have all the time in the world to take tests and score higher in the school. So I say this simply because parents need to not worry about any stigma about that, and just get whatever services your child needs to move forward.
Perfect, perfect. Well, we are just about out of time. I want to thank all our panelists here. This has been fascinating, and we could go on and on about this, and probably should go on and on about this, because I'm with you, Dr. Pugh. I think maybe there are lessons to be learned, and I'm not sure they've been learned all the way yet. So I think we've got a long way to go still. I'm going to turn this back over to Amber. Thank you very much.
Thank you all so much for participating in today's Bridge Lunch Break. Thanks especially to Dr. Gomez, Dr. Pugh, and to Ashley for participating and sharing with us your knowledge and your experiences today. Thank you to Ron for moderating, and thank you to all of our participants. As you heard at the beginning of the conversation, we have been recording today's conversation, so we'll be posting that recording on Bridge's website, bridgemi.com, later this week. So if you know someone who needs to see this conversation that wasn't able to join us today, we'll have a link to our YouTube video so that they can watch it at their convenience.
Thanks, guys. Yeah.
All right. Thanks.
Thank you very much. Really enjoyed it. Thank you very much.
Thank you for being here today. Have a great day, and we'll talk to you all in June. Take care. Bye-bye.
Thank you. Take care.